On the News Channel 5 network, this is MorningLine.
Good morning, everyone. Nick Barris here. Thanks for joining us on MorningLine. It's a Tuesday. Good to have you with us. Leland, I was busy down in the newsroom. Is it going to be sunny today?
No. More clouds than sun.
More clouds than sun. But important to note that even when clouds are out and it's overcast, yes, you can get rays of the sun and you can burn. And that's kind of what the topic of our conversation is today as we segue into the spring, into the summer. A lot of us spending more time outside. Every year we try to do a program along these lines, talking about sun safety outside and protecting your skin. And, you know, as we've seen, it's to me, people that I know have had more skin cancers or early warning sign moles, things like that, lopped off than ever before. Is the sun more intense? Are we spending more time outside? What's going on and what can you do to protect yourself? It's something you have to think about. It's changed the way I handle going outside. We're going to talk about that this morning. We'll open up the phone lines, get the number up on the screen. Our guest with us this morning is Dr. Bill Stebbins. He's a dermatologist over at Vanderbilt. Nice to have you on. And you're not here to talk about acne from that perspective of a dermatologist, but more skin cancer surgeon too, correct?
Yes, yes.
You've got very nice skin. It appears as though you are cautious when you're outside. You slap on a lot of sunscreen when you head out.
I do, and I didn't for a long time growing up. Growing up, we didn't really know much about sunscreen until mid-'80s or so is when 15 was actually even invented, 15 SPF.
Right.
That's the first time it was available. So as soon as I got into the field of dermatology, I learned very quickly the importance of wearing sunscreen, and not only sunscreen, which is what we always talk about, but really sun protective measures. So that means being in the shade when you need to be in the shade, and wearing sun protective clothing.
You know, I'm going to get into all the stuff we can do preventative-wise, but what you just said to me about, the two of us, and I think I'm older than you as well, but back when we were kids, they didn't really know it. And I've heard people say that if you had suffered 1 or 2 severe burns as a child, and trust me, I suffered far more than that. And then even if later in life you become very aware and are very protective, just the damage you did to your skin as a child when perhaps you just didn't know any better can come back to haunt you. True or not?
Absolutely
true.
Well,
that's great. Then what's the point?
Well, the point is that we can actually reverse some of this damage.
Okay, but it is true, meaning, so something where I maybe suffered a burn when I was in my early teens or something, or before that, I mean, it's gone. I mean, but it's deep in my cells somewhere?
Exactly. So that DNA damage has occurred, and your body repairs some of that. And we look at sort of our quartiles of life in terms of how much sun we're getting. And by the time we're 18, we get about a quarter of our sun exposure total. Okay. And the stats show that if you get a couple of blistering sunburns before the age of 10, you have it significantly increases your risk of getting melanoma later in life. And so, although it seems like, well, the cat's out of the bag or the horse is out of the barn, what else can we do? Why even bother? Number one, you can become more vigilant about your sun protection, and you can see a dermatologist more frequently, knowing that you've had those burns, knowing that you have that risk factor. And number two, just by wearing sunscreen, you're going to prevent not only melanoma, but also non-melanoma skin cancers. And so,
was that like basal cell?
Exactly.
And what is the difference, if you would? I've had actually a couple basal cell melanomas taken off.
Okay. So I like to think of it as 2 branches. There's melanoma, and then there's non-melanoma skin cancer. So melanoma, there's about 150,000 per year in the United States, half of which are invasive or the more dangerous kind.
Yeah, you hear melanoma, and that's scary.
So then we go to the other side, and we can talk more about that, but the other side is non-melanoma skin cancer. In the U.S., there's at least 3.5 million per year. 80% of those, so 2.5 million or so, are basal cell carcinoma, and about 1 million are squamous cell carcinoma.
Okay.
And so basal and squamous cell carcinomas are by far the most common. And they, again, can lead to not only local tissue destruction. So imagine if you have a spot like a basal cell on the tip of your nose that needs to be removed. That can lead to, in theory, could be a disfiguring tumor.
Okay.
And of course, the longer it goes and the larger it grows, the more issues you may have. They don't tend to be deadly in the same way that melanoma is. Squamous cell carcinomas are sort of in between. They are most commonly locally destructive, but they too can be fatal if left untreated.
Okay, and the solution to that is to go to the dermatologist, have them look you over. You can eyeball a lot of them, but then you can take them off and then send them to be tested?
Exactly. So when a patient comes to us for an examination, you know, we've looked at millions of areas, right? Whether it's moles or nevi, as they're called, skin cancers, regular freckles, or just sun damage. And you know, over the years, we become trained to spot the dangerous ones, and also to track people longitudinally, not just to see somebody at one moment in time, but to also say, well, we saw you last year. Let's see what's changed since then. And so when we do notice something that's changing or growing or bleeding, or somebody comes to us with that issue, we will then recommend a biopsy usually. And a very small piece is removed. That's sent to our dermatopathologists. So those are usually, in our case at Vanderbilt, dermatologists who have also done specialty training in reading these under the microscope. And we'll have a diagnosis, and from there we'll make a treatment plan.
Okay. We're going to take phone calls, especially after this first segment, if you'd like. 737-7587. Question, maybe something you observe on your own body, or maybe you're wondering who's at high risk. And that was one question I wanted to ask you now. I imagine all of us, if you get overexposed to sun, you know, are facing an issue here that you need to be concerned with. But are there some that are going to be more susceptible? And what are the factors you should look at to determine whether or not you're someone who needs to be extra cautious?
Well, that's a great question. It's basically someone that looks like me.
Okay, very fair-skinned?
Fair-skinned, blue eyes, blonde hair, red hair, freckles, green eyes, anyone that's sort of just paler complected in general. That being said, really anyone can get skin cancer. Bob Marley died of skin cancer.
I was going to say, so African Americans can now. Again, we're talking about pigmentation. It is, when you tan or when you burn, that is your body reacting to overexposure. It's essentially, you know, and in our society, okay, it's crazy, but you know, people they say a healthy tan, and I've heard other people describe a tan as essentially a precancerous glow. Okay, and so it's kind of like, yeah, in our society, you know, we have stains, we have tanning salons, all kinds of things, and it's true. You see bodybuilders, they tan because it highlights the muscle more. But you know, tanning like that can be dangerous to everyone. But African American, the pigment of their skin, because it's darker, should that not be able to handle the rays better?
In a way it is, that's correct, and certainly there are incidents. If
you're darker pigment in general, whether you're black, white, whatever, darker pigmentation, as you say, should handle it better than someone as fair-skinned as you.
Correct. It absolutely does. You know, the way I think of it, if someone my color gets a tan, it's really my body attempting to put up a shield, you know, the cells produce pigment to shield our DNA from the ultraviolet rays.
Okay.
And so you think of a tan really as your body trying to produce a shield to protect your cell's DNA. In darker skinned individuals, it's true that you don't see the same incidence and patterns of where these tumors show up, and it is much lower. However, all skin types still develop melanoma, basal cells, squamous cells, but it is true that it is lower in darker skin types.
Interesting. And is it also true, if you have that exposure, it's odd. I've seen people before who had a lot of sun exposure, and then the melanoma shows up in a part of their body that was not exposed to the sun.
Absolutely.
Now, what the heck is that? Meaning it might be on their hip where their swimsuit, and they never really got exposure there, even though they were getting burned up here all the time.
Exactly.
How's that?
You know, it's not been perfectly elucidated yet why that happens, other than to say we know that certain melanomas are caused by sun exposure, and strangely enough, sometimes intermittent sun exposure. So people that might be indoors all the time and get the occasional burn on the weekends, they may be at higher risk than people that are farmers, for example. We don't quite understand
because they get
that.
used to it, maybe your body conditions to it?
It's hard to tell what factors are playing into that, and I don't think we really know, but they believe it is some sort of protective factor about being out there all the time. That being said, they get countless other tumors as a result of being out there.
Okay, I gotcha.
The reason melanomas can show up in areas like the GI tract, the back of the eye, you know, inside the mouth, basically they can show up anywhere where there are melanocytes, and those are pigment cells. And that has to do with either a familial predisposition, so a genetic mutation that's been passed down, or another, just a sort of spurious mutation of a of a cell that leads to a skin cancer in a place that you wouldn't necessarily say UV is the trigger. And that can be, again, just a random mutation. So about half of melanomas are caused by sun exposure, and the other half are caused by mutations in the DNA that occur for a number of other reasons.
So interesting, gosh. And what we learn about this continues to evolve. And the more we learn, it seems like the more we realize that too much exposure to the sun is just really bad for you, all right? Even though we know it feels good to sit in the sun sometimes. You protect yourself, though. Look, we need to take a break. When we come back, phone lines will be open, 737-7587. I want to ask you more about the preventative measures. A lot of this basic stuff you may know, but also, it's been years. I did originally years ago go to a couple of these tanning salons. I don't do it anymore. I have not been in a tanning bed in decades, but tanning beds, still, I see they're busy right now. And then the spray tans and the stains, and what you think of some of those as maybe a substitute for tanning if you still want to get color. If you have any questions, give us a call. We'll be back with more right after this.